Salt. When I was younger and learning how to cook, I was told by many that salt was the magic ingredient. Add it liberally, they said. It enhances the flavor of what you're cooking, I was told repeatedly. It brings out excess moisture in certain foods that make the foods even better. But what wasn't I told? Was it told that salt raises your blood pressure, putting you at greater risk for strokes and other cardiovascular events? Or was I told that too much salt puts extra pressure on your kidneys to get rid of the sodium? Or was I told, as a meta-analysis from the American Journal of Clinical Nutrition showed, that as salt intake increases, bone mineral density decreases? Tonight, we'll learn much more about not only the medical truth about salt, but nitric oxide's importance in your health from this evening's special guest, Dr. Leigh Ettinger. And we'll get everybody on the stream as well as my co-hosts. I'm Jim Spellos from Plant Powered Metro New York, and along with Judith Zerden and Ben Mertens, we welcome you to this conversation, Heart to Healthy Heart, plant-based conversations that can save your life. As always, we encourage you all to use the chat box. Let us know where you're from. Ask questions of the doctor. We will take as many as we can as time permits in our 30-minute time slot. So now let me just introduce tonight's special guest, Dr. Leigh Ettinger. Doctor since 1998. Pediatric kidney specialist since 2004, herbivore since 2014. He quickly saw the benefits of plant-based eating for himself and started sharing advice with his patients. He earned the E. Cornell Certificate in Plant-Based Nutrition in 2016. The following year, he joined the staff of the hospital's Pediatric Weight Management Program. In 2019, he became a diplomat of the American Board of Obesity Medicine, and in 2021, he founded the Dr. Herbivore Telehealth Practice, which accepts practice members living in New York and New Jersey, ages 2 through 21, with obesity for a 12-week plant-based program. He also offers a 4-week program to evaluate and fine-tune the nutrition of vegan, vegetarian kids and e-courses to help families thrive. Dr. Ettinger, it's such a pleasure to have you on the show tonight.
Thanks so much, Jim, for having me here. It's really a pleasure to be here.
So I'm going to hand it over to you by asking you a very simple question. It's an easy one. Does salt really raise blood pressure?
The answer is yes. It's been known for actually since the 1830s that salt raises blood pressure. I've had a long interest in salt, actually. I've had a long interest in blood pressure. I actually did an 11th grade science project on blood pressure that won 4th place at the local science fair. And I got a $5 prize, which I promptly spent on the way home with friends at a fast food restaurant. So I didn't quite make the connection between salt and blood pressure back in 11th grade, but I'm here to talk to your audience about salt and blood pressure. So first, definition, high blood pressure, also known as hypertension, is a condition where the force of the blood against the wall of the blood vessel throughout the body is too high. But that's just half the story. Let me tell you about this other half of the story called flow-mediated dilation. Now, after the blood pressure cuff is released on the arm, blood rushes back down to the lower arm, part of the arm, through that main artery in our arm. Now, the artery needs to dilate to accommodate this increased blood flow. So here's a slice through a sample artery, and it needs to get bigger. Rushing blood flow causes shear forces on the endothelium. So they feel the stretch of the blood being flying by, and that stretch releases nitric oxide in response. And nitric oxide goes further down the arm, and it's a potent downstream vasodilator, letting the arm and the fingers know that more blood is coming. Flow-mediated dilation is the percent change in diameter of the artery relative to baseline diameter before the blood pressure cuff was squeezing. And more is better. A typical number of percent change that's considered good is maybe 5, 8, 10%. If someone's ever had nitrogen paste under their tongue, for example, that can make the blood flow-mediated dilation go up to 30%, really open up those blood vessels. And low flow-mediated dilation means that you're not making enough nitric oxide, and that's called endothelial dysfunction. Endothelial dysfunction causes white blood cells to stick to the side of the blood vessel, causes platelets to stick to the side of the blood vessel, causes the blood vessel to tighten, causes lipids and cholesterol to stick to the side of the blood vessel, and all that makes the blood vessel tinier, and the walls of the blood vessel actually thicken, they proliferate. And all that is progression of atherosclerosis and cardiovascular disease. And it's kind of a vicious cycle. As your blood vessels get tinier and occluded by all of these materials, the heart has to pump harder and to push the blood through this plumbing that's getting clogged up. So we see higher blood pressure numbers, and that just makes more endothelial dysfunction. And it's a vicious cycle until ultimately there's end organ damage, a stroke, a heart attack, outcomes like that. So I just want to talk about salt and how salt affects flow-mediated dilation with some studies. So these were studies of a group with normal blood pressure, and they were fed a salty soup. Well, actually 2 soups with the same amount of calories, carbs, fat, protein, and potassium. One of the soups was low salt and the other was very high salt. And their flow-mediated dilation was tested after each of these salt mixtures in the soup. And as you can see, the high salt group had much lower flow-mediated dilation. So that's concerning. And then here's another study looking at groups of people that were in random order, either had a week of a low salt diet of 2,300 milligrams per day, or a week of a high salt diet, 7,000 to 8,000 milligrams per day. And at the end of the week, they either did this week first and then that week, or the high salt week and then the low salt week. And at the end of the 2 weeks, their blood pressures and their flow-mediated dilations were compared. And the group that had the higher salt week had much less flow-mediated dilation. So you can see they weren't able to dilate their blood vessels as well. So these are actual studies of people with pre-hypertension, trying to figure out if lowering their salt intake would help their blood pressure. So this first group of 744 individuals with pre-hypertension, over about a year and a half, they were instructed on how to lower their salt in their diet by 1,000 milligrams per day. So here's the usual care, got no salt lowering, and then this was the group that got their salt lowering. And then this second group of 2,300 people, again, adults with pre-hypertension, but this also they had obesity, and they did a 3-year trial of lowering their salt, and they were split into 4 groups. So this group had no sodium intervention and no weight intervention. This group had no sodium intervention, but did have a weight loss intervention. And then these 2 groups were instructed on lowering their sodium, but no weight intervention, and then a weight intervention. And so looking at these groups and trying to compare the salt lowering group, how did their blood pressure do? And not so much. As the kids today say, meh. So this group that tried to lower their salt, their blood pressure just improved by a little bit. And then this group that lowered their salt had no significant changes in their blood pressure. So a big whatever. But the researchers were smart in that they followed these groups for the next 12 to 15 years. And sure enough, I hope you can see, there was a big difference over the next 10 to 12 years as to which groups had heart attacks and strokes. So this is time on the bottom axis. And each time someone has a heart attack or a stroke or surgery to revascularize their heart or died due to cardiovascular disease, the line goes up. And as you can see, the control group had no change in their salt, and they ended up way up here and way up here with a lot more of these events. And the sodium intervention group, the purple group, they're the ones who lowered their salt intake. And as you can see, they had much less of these bad outcomes over the decade after those 2 studies. And they had a 25% risk reduction. Even though their blood pressure didn't improve much during the actual trial, over the following decade, they had a much less chance of having these bad outcomes. And you think about a blood pressure lowering drug, it would be a blockbuster, $1 billion drug, if it lowered someone's risk of these bad outcomes by 2%, 3%, 5%. Total blockbuster drug. Would be a malpractice if you didn't prescribe it, if it gave a 5% reduction over 10 years of these bad outcomes. Here, lowering the salt intake over that year and a half or over those 3 years reduced someone's risk of a bad outcome by 25%. So in my mind, this should be the first line above and beyond even those puny benefits of the medicines. So it's interesting, even though the blood pressure did not improve by much, maybe what was going on was that their endothelium function improved, that their flow-mediated dilation improved. So during the time that they were working in those studies, lowering their salt intake, that their endothelium was not constricting as much, was not allowing the cholesterol, the plaques, the platelets to adhere to the sides of the blood vessels. So my message is to eat foods without packages. A banana doesn't have a label on it because no salt has been added. Foods that came out of the ground or off the tree are whole plants, and there's no extra salt in there. There's actually so little salt in whole plants. If you think about it, the herbivores on the farm need to be given a salt lick. Out in the wild, herbivores lick rocks or dry riverbeds to get their sodium. Carnivores, however, don't need a salt lick. They eat the muscle of the herbivore that gathered the salt. So we can lower our salt intake and reduce our risk of bad outcomes from cardiovascular disease by not eating the muscle, not eating the meat, but eating the plants. We don't need to eat the meat because that just is a load of salt that was collected by the herbivore. Well, thanks for your attention. I'm happy to answer any questions now about salt and blood pressure, and here's how you can contact me if you have any other further questions or comments.
Fantastic, Doc. Thanks so much for that presentation. Awesome stuff. I saw in one of the notes that the low salt group was 2,300 milligrams. That seems still high to me, but that's another story for another time.
Yes, yeah, there are indigenous populations throughout the world, less so these days, but historically that have been studied, that eat 1,000, 1,500 milligrams of sodium per day. And interestingly enough, their blood pressures stay the same throughout adulthood. The 55-year-olds have the exact same blood pressure as the 15-year-olds. They just don't have the rise in blood pressure that people that are eating the Western diet do over time. It's an observational study, but it points to one of the dangers of salt in the diet.
So in 30 seconds, what's your whole food plant-based story? How did you actually become Dr. Herbivore?
My origin story. So I didn't learn about this in medical school. I enjoy cycling and was watching cycling videos on YouTube. And in 2014, a cycling video popped up of a guy. It was Stuff Cyclists Say, and it was a funny, humorous video. And I laughed and looked at this guy's other content. And sure enough, he is a cyclist who's vegan, and he's biking all over Australia, eating rice and mangoes. And I'm like, how's this possible? Where does he get his protein? And I started to learn more and more about him and thought, well, maybe this will help my cycling. And sure enough, I'd lost weight and my blood pressure, which was creeping up, went down. My cholesterol, which had always been high, went down and normalized. And I started to learn more about it from documentaries and from the luminaries of the field, like Dr. Esselstyn and Dr. McDougall and Dr. All of them, and got a certificate in plant-based nutrition and got board certified in obesity medicine and started to call myself Dr. Herbivore. That's my story.
Ben.
Yeah, doctor, what got you interested in delving deeper into nitric oxide research?
Yeah, it just helps explain. As I said, I've always had an interest in blood pressure, and it's the flip side of the coin. And understanding the flow-mediated dilation helps you understand why hypertension does what it does to people. And some of the medicines that we use, like I said, the nitric paste, the nitroglycerin paste, how that works, the mechanisms. So it's just part of understanding high blood pressure. And as a pediatric kidney specialist, I would get a lot of referrals from local pediatricians who are concerned about high blood pressure in their patients, because in the pediatric age group, that can often be a sign of kidney disease. And so they would come to me, I'd rule out kidney disease, heart disease, hormonal problems, and I'd be sitting there with a family, with a patient who had an elevated body mass index, and started to talk to families about lowering salt in the diet. I had some education about how to do that in general. But once I learned about the plant-based diet and the benefits and more about nitric oxide, then my advice started to change, and I was helping families get off of blood pressure medicine or not have to start blood pressure medicine. And that was very rewarding for me. I could easily lower someone's blood pressure with a prescription, but no one ever said thank you when I gave them a prescription. They were always like, do I have to take this forever? But if I could show someone how to change their diet and lifestyle and not need the blood pressure medicine or get off of the blood pressure medicine, they would come back and say thank you to me. And that was very professionally satisfying.
Great. How do nitric oxide levels change with age and with change of diet?
Well, the nitric oxide is, I don't know the exact, it definitely, you get precursors, oxide precursors, leafy green. Dr. Esselstyn talks a lot. He is dealing with, his patients are already having cardiac disease and already have been told that they have severe cardiac disease, and they come to him for dietary advice, and he has them chewing leafy green vegetables 6 times a day in order for the microbiome, the bacteria in our mouth, to break down some precursors of the nitric oxide and get those precursors into our bloodstream so that they can easily be available to be turned into nitric oxide. So it's not that our nitric oxide levels change over our lifetime, but certainly the effect as the arteries get more and more clogged with all the debris I was talking about, they're less responsive to the nitric oxide, and then salt suppresses the nitric oxide production. There's mechanisms shown in animal studies as to how that works. So the effect of age is changes in the microbiome and changes in the responsiveness to the nitric oxide.
And change of diet?
Well, if you're eating the standard American diet your whole life, then the sodium is what's causing the damage, as well as other, the cholesterol that you get is what can lead to the plaque deposition as a substrate for plaque deposition. There's a lot of factors above and beyond just the salt.
So in connection with your nephrology practice, I'm sure that you deal with the effects of salt on kidneys all the time. And I just was wondering if you could explain to us why salt is harmful to your kidneys.
Yeah, so the kidneys and the heart are constantly communicating about blood flow. The kidneys actually get the largest amount of blood of any organ. More blood goes to your kidney with each heartbeat that goes to your brain. So the kidneys are very sensitive to what's going on with the blood pressure, and they might signal through hormonal signals to the heart to raise the blood pressure or lower the blood pressure. They kind of have a barometer inside that can, if you're dehydrated, they say, well, let's heart pump harder. I need more blood. But unfortunately, the kidneys can also be the recipient of that extra blood pressure and get damaged by the blood pressure. And so high blood pressure, the kidneys can be a cause of high blood pressure, but they can also be damaged by high blood pressure. And as kidney damage progresses, either from the high blood pressure itself or from other diseases, then the kidney again is saying, I need more blood to do the job, give me more blood pressure, but that's the kidney acting selfishly, and the blood pressure can ultimately damage the kidney more and damage the other end organs like the brain or the heart itself or the back of the eyes, other targets of the high blood pressure, delicate parts of our body that don't respond well to the pounding of the blood pressure waves.
Is the salt considered inflammatory to the kidneys?
Not per se. The kidneys, that's their job, is to manage the salt and regulate the salt content of the blood. And if there's extra salt, they're just doing their job getting rid of the salt. It's more that the salt can decrease the nitric oxide production, and that can lead to more high blood pressure and lead to all that stickiness of the plaques and the cholesterol. And certainly the kidney is a very vascular organ. So if you get those kind of plaques and occlusions and clottings in the kidney, then it can be damaged too, just like those effects in the coronary artery. So I don't think of the salt directly hurting the kidney, but the salt can start a cascade of events that can damage the kidneys, as well as the other organs like the heart and the brain.
Are there any healthy salts like Himalayan sea salt, for example?
So they're all sodium chloride. The Himalayan salts and the other fancy salts that you buy just have more of the other minerals. When you buy over-the-counter table salt, it's just sodium and chloride. But the benefit of those other salts is that you're getting some other minerals that weren't taken out in the processing. So if no one really has, if you have an adequate diet, these kind of mineral deficiencies. So I don't think that those more expensive salts are giving you any benefit. You're likely just urinating out those extra minerals. But yeah, you're still getting the same sodium chloride, which is the harmful component of salt.
And what about substitutes like potassium chloride?
Yeah, potassium chloride certainly can help get you the saltiness without the sodium. So yeah, people don't really do that. Do people put potassium chloride on their foods? I don't know. Do they?
Think so. We have a few questions from our audience now. I'm going to jump in here to have these show up. And one of them is about a fruitarian diet. Can they get enough nutrients to survive a healthy lifestyle, or I would imagine to thrive in a healthy lifestyle?
Let me just finish my answer to that question. Is I prescribe potassium chloride for people who have had low potassium for one reason or other. Sometimes it's as a side effect of the medicine.
Please leave.
So I've been prescribing it, but I don't know that people really use it other than by prescription. But
Cool.
So your question about fruitarians. So yeah, I've never met a fruitarian, but I hear they exist. I've heard them interviewed. My understanding is that they need many. The guy I heard interviewed needed 4 refrigerators, and he needed a truck to go to the supermarket to carry a refrigerated truck to carry all of his food. And he needed to eat 20 pounds of food per day in order, because the fruits are like 99% water. And so he was just basically eating all day, and he was thriving. He was even a marathon runner. This is all anecdotal evidence. So he was getting all of the carbohydrates, fats, and proteins, and vitamins and minerals that he needed, but it was an extreme effort. So I hear that some people eat raw plant-based, and again, that there's so much fiber and water in these raw foods that they really just need to eat a lot. There's a program that I like to use called Chronometer, which is free, where you can enter your day's dietary recall and get a printout of the amount of calories, the carbohydrates, fats, proteins, and 82 micronutrients. So you can make sure that you can plug in what you're doing and make sure that you're getting adequate copper, adequate selenium, things like that. So for questions like that, if you're really curious if it can be done, then I would say, you put in your age, your height and weight, your activity level, and you can get some feedback, and you can even get some hints from there as to how to boost up one or another nutrient that might be low.
Doctor, for those that eat processed food, you have any tips for reducing salt consumption?
Sure. I can go to another slide.
Mm-hmm.
So this is a little trick I like to show my families that I'm working with on, if you are going to eat a food with labels, how to reduce the salt in your diet. So the guidelines say that we should be aiming for, let's say, less than 2,000 milligrams of sodium per day. And the typical adult may be aiming for 2,000 calories per day. So we're keeping those two numbers the same for this little project, this little tip. So if I'm aiming for 2,000 calories and 2,000 milligrams of sodium, that would be a low sodium diet. So let's go along and look at this package of cornflakes. Perhaps you've seen these. They're like travel packs. You peel the label off and pour the milk right in. So I'll look at this package of cornflakes and I'll say, well, how many calories are here? 80. And how much sodium is here? 150. So I'll look and I say, what if I really love cornflakes so much that I'm going to eat cornflakes all day? I'm going to eat 2,000 calories of cornflakes. How much sodium would I get? So I get that 80 turns into 2,000 calories. And how much sodium, you can see it's like twice as much sodium per calorie. So I'm actually going to get 3,750 milligrams of sodium. And that's much too much sodium if I'm aiming for less than 2,000. So yeah, I consider cornflakes a very salty food. Now, I'm not going to eat cornflakes all day long, but if I start my day with more salt than calories, by the end of the day, I'll have more salt than calories if I continue on that trend of eating. So my tip for families is to go in when they're shopping to find foods where the sodium number is less than the calorie number. So you'll get your calories for the day and a lower amount of salt for the day, especially if you throw in some foods, some whole plants that will give you the calories without any salt. So that's a trick. But honestly, it's hard. Families come back to me, oh, I didn't know my yogurt had so much sodium. I didn't know my granola bar had so much sodium. There's really salt in everything, both for flavor and as a preservative.
Is salt as big as a problem for kids as for adults?
Yes, yeah. Kids are eating a tremendous amount of salt too, much more than they need. Yeah, they're drawn towards salty foods. Evolutionary, it was very appropriate for us to get sodium. We need it for life. Everything that's alive needs it, so we are drawn to it. I think the food companies are taking advantage of our instincts and just putting it in our cornflakes so that we buy more cornflakes. So yeah, unfortunately, we're all getting too much sodium and seeing high blood pressure even in kids because of it.
So other than lowering salt intake, how else does a whole food plant-based diet improve both kidney and cardiovascular health?
Ooh, how much time do we have? You've had several other doctors on here talking about that, but yeah, just by not having the saturated fat, the trans fat, not having the cholesterol that are found in all the animal products really can reduce the risk of cardiovascular disease, having low sodium, having more phytonutrients and antioxidants in the plants that are not in the animals. Those are really beneficial. Having more vitamins and minerals in the plants, these are all beneficial for heart health. People with observational studies of populations that are eating more plant-based show that they have a lower BMI, and that's a body mass index, and that's associated with improved cardiovascular health. So there's a lot of factors. And
So,
someone who's thinking about their food in such with such care also, and this may be a confounding factor, but someone who's thinking about their food with such care is less likely to be smoking, is more likely to be exercising. So it's part of a whole package also. And that can confound some studies because you don't know whether the benefit is because they're eating healthier or because they're not smoking. But in general, it comes with a package of someone who's taking care of their body, taking care of their temple.
Yeah, we've previously focused on cardiovascular health and whole food plant-based diets. So I was just wondering if the connection and the benefits are the same for kidneys. Like if you have the beginnings of CKD, chronic kidney disease, would switching to a whole food plant-based diet improve your kidney health as well as your cardiovascular?
Yes. Unfortunately, there's nothing that can reverse kidney disease as we know it today. But or when I see kidney disease, I'm saying there's lots of kidney diseases, but particularly the damage that happens to a kidney that causes progression ultimately to need dialysis or a kidney transplant. There's nothing that can actually like reverse that trend, but there are certainly healthier eating can slow the trend or hopefully stop the trend. But once you're kind of on that slippery slope, it's at this state of medicine, it's impossible to reverse. But that being said, we've learned about how, and you talked to other doctors about how the plant-based diet can help with coronary artery disease and cardiovascular disease. You can think of the kidney as just an organ that's full of blood vessels, and anything that's going to keep those pipes clean and open and better perfused is going to make the kidney a lot happier and able to do its job a lot better.
We are almost out of time. We do have one more question from our audience, and that's just for this particular food in nitric oxide. Do beets help increasing nitric oxide, or does any food help in increasing nitric oxide?
Yes, yeah. Dr. Esselstyn has his poem or his rapid fire list of the greens that really help. But beets also, although I can't quite give you an exact amount of beets, and some people say it's like you have to eat like pounds and pounds of beets to get the amount of nitric oxide that would actually make a difference. But anecdotally, I used to bike to work, and twice I had beets on my salad from my hospital's cafeteria. And on those 2 times, I biked home very quickly. I felt, I use an app that records my speeds over segments of roads, and I had very, very quick rides home. So anecdotally, I can say those 2 days that I had the beets on my salad, just a sprinkling of beets, but I feel like I noticed it might have been placebo effect, but I was biking fast on the way home those 2 days.
So add those beets to your salad every day. I know we do here. Dr. Ettinger, just want to make sure people know how they can reach you. drherbreport.com is your site. We are so honored and pleased that you have joined us tonight. So thank you so much for being here, for all you do for your patients and the families and helping them with issues of pediatric obesity. It's been a privilege having you here tonight.
Thanks a lot. This was fun.
Awesome. So next month, actually, as we complete, believe it or not, our first season of Heart to Healthy Heart. Had time flew there. We welcome the creator and director of Heart Smarts, Dr. Na Solo Tete, to our broadcast. That'll be Wednesday, the 24th of May at 7 o'clock. And again, it's right here on YouTube channel, on Facebook, and even on our LinkedIn channel when that tends to work. So if you want to watch any of our episodes again, they're all on the Plant Powered Metro New York YouTube channel. On behalf of Judy and Ben, I am Jim Spellos, wishing you a wonderful day, a healthy, optimal health. And we look forward to seeing you once again next month on Heart to Healthy Heart.